Anytime a virus such as the new coronavirus, or SARS, flares up, public health agencies and disease specialists kick into high gear to safeguard the general population and healthcare workers who will be on the front lines. How exactly do they do that, and how well is it going this time? Let's ask Dr. Susy Hota, Medical Director of Infection Prevention and Control at the University Health Network and an Associate Professor of Infectious Diseases at the U of T's Medical School, and Mario Possamai, who was a Senior Advisor on the SARS Commission and currently a consultant in occupational health and safety issues. And it's great to have you here and you back here. You were here a long time ago, weren't you?
About 10 years ago.
Yes, indeed, when we talked about SARS. Okay, Dr. Hota, let's get started with this. It's been a month now since people heard about the coronavirus, now officially with a new name, COVID-19. How much more do we know today about how infectious this disease is than we knew a month ago?
I think we know quite a bit more. As we get more experience with additional cases and people start to summarize those and publish their experiences, we start to see some information that's coming across consistently. And I think one of the things we know is that this is transmitting from person to person. And we look at something called a base of reproductive number, or an R0, which tells you on average if one person is infected with the virus, how many other people could be infected by that individual.
And what's that number?
And so right now it's looking like it's somewhere between 2 and 3 for this virus, probably closer to 2. So that helps to give us a reference compared to other viruses that we're more familiar with in terms of how infectious it is.
And is that a relatively, it sounds like a relatively small number as opposed to, we're not talking thousands here, right?
Yeah, well, so you have to put it in context.
Okay.
So it's comparable to what we see with SARS, for example. However, what we are seeing is that we're continuing to have these chains of person-to-person transmission that happens on and off within, China. We're seeing quite a bit of it, but also outside of China. And so in that sense, it's behaving a little bit differently from what we saw with SARS, where it was a little bit more limited in terms of where we saw the infections occur.
Are we getting a more accurate picture today of how deadly it is?
We are. So over time, we're, again, summarizing more and more cases of people who are infected with the virus. And it looks as though about 2% of confirmed cases, lab-confirmed cases, are resulting in death. Now, the problem is we don't know the full extent of people who are actually infected with much more mild illness. And so likely it's lower than that.
And again, that, relatively speaking, is a pretty good number?
I think it's, it's good or bad. It all depends on how many people end up being infected with this. And because there's no pre-existing immunity amongst the human population with this new virus, this has a potential to infect quite a few people over time. So you just have to kind of watch what the numbers are doing and also see if there are any trends in terms of some risk groups being at higher risk of dying. And right now, it does appear as though those who are over the age of 80 tend to be at highest risk of dying from the disease.
Which takes us now to Mario Possamai. What differentiates what we're experiencing right now from a full-blown pandemic?
Well, a pandemic is kind of a soft definition. It's really sustained transmission, in a number of continents. So right now, it's, we have major cases in China, of course. A few cases here. More cases in Hong Kong and Europe and the UK, but we're not there yet. But I think the major difference with SARS is that SARS was primarily nosocomial. It was primarily transmitted in hospitals. Here we're having more spread in the population. There was a paper that came out. I got it emailed at 4 o'clock this morning, and it showed that they looked at 74,000 cases in China, and they found that about 1% were asymptomatic. So these are cases that were lab confirmed as being carriers of the virus, but didn't show symptoms. So there are a lot of wrinkles like that that are coming out that are important and interesting. As our knowledge evolves about this new coronavirus.
But to be clear, then, if SARS, which Ontario experienced, I guess, 17 years ago, if that was mostly an illness that was transmitted in hospitals, as opposed to this one, then this one's way worse, right? Is that fair to say?
Absolutely. So early on in the SARS outbreak, no one knew whether it was going to be community spread. And in fact, there was an early plan, and Dr. Hota and I were talking about it, and it was really based on the BC pandemic plan because, sadly to say, Ontario did not have a pandemic plan those days. So there were preparations for community spread. Luckily, we didn't have to see that. But I think, it gave us a taste of, even if it's restricted to healthcare facilities, what damage, an outbreak can do.
Well, and this one's clearly not restricted. Of course, the epicenter was China, but then, of course, we're now seeing it's on cruise ships now, and we're seeing the impact that that's having, never mind on that industry, but, anybody who might have been on the wrong cruise ship at the wrong time. What does it tell you about the fact that hundreds of people who are on cruise ships are now getting infected?
Well, the study that I got at 4 o'clock this morning said it's pretty darn obvious, but I said, this is highly contagious. And we also don't know enough about it, about transmission dynamics, all these things. So it's early days. And, I think the other important thing is that what we're seeing now is unprecedented. About 10 years ago, the CDC and the U.S. Department of Defense and some other groups had a workshop, and I was down there with Alison McGeer, with the Canadians, and it was looking at were there historical experiences, whether it was Spanish flu or any other epidemics, that could help us, inform us if we had to do big things in response. Big things like quarantine a city or things like that, things that China's doing now, and there were no historical examples. So, what they're doing is unprecedented. Shutting down a city, a cruise ship, quarantine cruise ship. So there's no playbook. And so, I think some mistakes have been made. I think probably, in hindsight, the quarantining of the cruise ship in Japan was probably a mistake.
We'll get into some of this in a second here, but Susy Hota, let me ask you this. If you are fortunate enough to survive receiving this virus, what's it going to do to you?
So most people are recovering and having no sequelae of the infection. Those people who actually end up in the hospital and need a higher level of care or die from it tend to get complications either from overwhelming pneumonia or the immune system getting so overstimulated by trying to fight it off that you go into a shock kind of condition. And so that's what we're seeing in terms of the actual morbidity of it. If you recover completely, we're not entirely sure if you're going to have immunity that lasts for some period of time or if you could be reinfected with this virus again in the future, like we see with some of the other coronaviruses that circulate seasonally every year within North America and throughout the world.
Can we go back now? Let's go back 17 years.
Right.
When SARS did hit many places, including the province of Ontario, where were you when it hit?
So I was actually a medical resident during that time. So I was essentially a frontline healthcare provider. I spent a lot of the time during one of the waves of SARS in the emergency department in my hospital.
Which one?
That was Toronto Western Hospital.
Okay.
So I was seeing patients at the time, but a very different lens as to what was occurring compared to what I see now, being sort of, I guess, more in the control tower compared to, right out there, seeing patients.
You were on the front lines.
I was on the front lines.
Scary?
It's interesting, and part of it's a mentality, I think, of medical residents. You just kind of do your job. I didn't feel afraid. I knew something was going on that I needed to be paying very close attention to. There was a lot of confusion. Things were changing day to day in terms of what kinds of measures we were asked to take. It was stressful and it was difficult. I won't lie about that, but I didn't feel afraid. I felt as though I had to put my faith in the people making the decisions on what we needed to do to protect ourselves in healthcare facilities, and I did it.
Was that faith vindicated?
Yes, I think in the end, people were trying very, very hard to protect healthcare workers. Mario's already mentioned that SARS was an infection that really disproportionately affected people who worked in healthcare facilities.
44 dead.
44 dead, and some within my hospital. So, people are very acutely aware of that. And it's had a long-lasting impact as well, as I'm now facing these other emerging infectious diseases and now a new coronavirus. One of the first assumptions that people made was, oh my God, this is another SARS. SARS. And so a lot of managing this problem within hospitals has to do with making sure that your staff are well aware of what's going on and well informed, and that they also can put the same faith that I was able to put into our infection control team.
Now, thankfully, Mario, we've had relatively speaking, very, very few cases in the province of Ontario so far, which is the good news. Do you believe that healthcare workers working in hospital settings in other provinces around Canada are as well protected and well off as apparently they are here in the province of Ontario?
No, I mean, that's a real concern. I've been involved, nurses unions have been involved as well. And there's been real concern about the Public Health Agency of Canada, which has taken this an odd position where they've, instead of taking the Ontario position, which is taking a precautionary approach that was recommended, core recommendation of the SARS Commission, that the principle of being precautionary is now part of the public health law. The Public Health Agency of Canada decided that their guidance is that a healthcare worker going to contact with a possible coronavirus carrier only has to wear a surgical mask. In Ontario, because we know so little about how this new virus is transmitted, it's taking a precautionary approach, and they're saying we have to make sure that healthcare workers have a higher level of protection, which is the N95 respirator, on the possibility, which might be remote, that perhaps there is airborne precaution. So Ontario healthcare workers are being well protected, I think. The provinces and Manitoba is going this direction that we're following the Public Health Agency are less protected. And that's worrisome because, imagine, you've got a nurse who maybe lives in Ontario near the Manitoba border, and they're working in Manitoba. By crossing the border, the guidelines in place there will be less protective than maybe his or her colleagues are in Ontario.
I see, and as I assume you do too, actually lots of people walking around with these masks on right now. And I guess a couple of things. Number one, to the extent that we know, this is not an airborne virus.
Right.
So those masks are useless or not, I don't know, you tell me, not really needed, I guess, or what?
I think at this point, not really needed in the general public. That's for sure. I mean, there are different types of respiratory protection. There are these tight-fitting N95 respirators that you actually have to make sure seals so that you have a really good protection and a filter against things that are transmitted by airborne route. So really small infectious particles. And then there are those very loose-fitting masks that you have over your nose and your mouth that really act as a barrier. And they're used for different types of infections. So for things that are transmitted by airborne route, like tuberculosis or measles virus, it is important to have one of those fit-tested N95 respirators.
But I don't see anybody wearing them.
Some people are wearing them in public, but they're not necessarily fitted to their face, and there's definitely no reason to be using it. I think right now, all signs point to this being something that's transmitted through large respiratory droplets. And if it was airborne, we would see a much higher attack rate, many more people infected. I think in terms of the precautionary principle that Mario had mentioned, there is a lot of value to that in the early stages of an emerging infection, because we don't know entirely how it's transmitted. And also in healthcare facilities, we're very mindful of some of the things that we do that might generate aerosols or smaller particles that can infect, as opposed to out in the public or in just routine care of a person. So in my view, I think we have to be cautious where it's important to do so. In other words, when things are happening in hospitals that are more invasive and can generate aerosols. But otherwise, let's be judicious about the use of masks in public, for example, where it's really not necessary.
I want to ask you about China. Mario, in your view, has China been a good international public health citizen in its handling of COVID-19?
Well, I think that's a very complex question because we're seeing different aspects of China on display. On the one hand, you've got there were arrests of the initial doctor who was a whistleblower. There's the containment that's part of an authoritarian regime to clamp that down.
They arrested him. Then they said he died. Then they said he didn't die. Then they confirmed he died. And he was the whistleblower who, anyway.
So you've got that, but at the same time, you've got some top medical people in China being able to publish, really frank analyses and papers in almost real time. There was a paper published in the Lancet over the weekend by 4 physicians, which warned about the subclinical transmission, but by patients. So, I think that there's a lot going on there.
How about numbers? How much confidence do you have in the numbers coming out from China these days?
I think that the numbers right now are pretty good from everyone that I've talked to. The study that I got at 4 o'clock this morning, they analyzed 74,000 cases. The analysis seems pretty rigorous to me. I think that there are again competing forces in China. I think the medical people want to get it out. They want to cooperate with everyone. I think the
political people are
political
scared.
People, yeah.
Yeah,
exactly.
Susy Hota, let me get your view on this as an infectious disease specialist. Do you see China taking the kinds of steps that you, as a specialist in this area, would want them to be taking?
I think they're trying to go above and beyond right now, in terms of the types of quarantine and lockdown measures that have been put into place, trying to do whatever is possible to contain it as much as possible. I mean, whether that's going to work, nobody really knows at this point in time. We're watching very closely. I do think it's been, I feel confident that at least there's a lot of cooperation between China and the WHO, and, they are reporting things much quicker than what we experienced in the past with SARS, for example.
Although Xi Jinping, we're told, knew about this for a matter of weeks before he went public with it.
Yes, and so, it sounds concerning for sure, but, we have to realize that in the early stages of any kind of infectious disease that's emerging, you want to be sure of what's going on before you mention it. And sometimes there are delays in getting information and getting the data together, so we do have to be conscious of that.
There have been some really strange-looking pictures on the internet about this attempt to quarantine anyway. And we want to show, can we show this now? Do you want to roll this video here? Sheldon, this is a video of Chinese paramedics who are attempting to enforce the quarantine. And, some people just don't want to go. And, it's obviously very intense and emotionally disturbing to the family involved. But I do want to know, what do you make of that when you see that?
Well, what I think about is the fact that during SARS here, we had 30,000 people, or close to that, in voluntary quarantine. And I think our issue is, what can we do? Look, I hope things don't go sideways here, and we never have to face any kind of a major issue. But I think we have to prepare ourselves to make sure that there's the same level of voluntary compliance in place that should this happen as we had during SARS. And that means making sure that employers are prepared for it, to allow people to work from home, allow people to be compensated, if they have to be quarantined. So I think whatever's going on there, I think we have to prepare ourselves to make sure that we're able to effectively impose quarantine and get voluntary compliance, because you don't want that. You want to make sure that people, like Torontonians did in 2003, voluntarily comply.
I don't know if you saw the pictures of people coming off airplanes, and there are people in hazmat suits waiting for them at the bottom, and as they're walking off the planes, they are just being sprayed. This is nothing the likes of which we've seen here ever before. What do you think when you see this stuff?
Some of those measures are likely not necessary, and I think that can be quite, frightening for people who are going through it. People are taking a very aggressive stance with this. I think it's sort of, let's see what we can do to try and contain it and stop it from being a pandemic. The sad thing is that quite often these viruses are a couple of steps ahead of us, so, we can try and see what we're able to accomplish with it. But you do have to moderate that with the sense of fear that it invokes. I think that's something to be conscious of.
When we do health on this program, we often invoke André Picard, because he's just simply the best in this country at writing about this. And he had this to say in the Globe and Mail a week ago. Can we bring this up, please, Sheldon? In recent years, we've seen the emergence of SARS, severe acute respiratory syndrome, MERS, Middle East respiratory syndrome, H1N1 pandemic influenza, Zika virus, West Nile virus, Ebola, Lassa fever, Nipah virus, Crimean Congo hemorrhagic fever, not to mention the resurgence of some age-old killers such as yellow fever, dengue, and malaria. The pathogenic threats that have flared up around the world with growing frequency in recent years are all, in a sense, a trial run for the big one, the so-called Disease X, that scientists and public health officials dread, one that spreads more readily and is more deadly than anything we've seen before. Let's get into this a little bit here. Susy, SARS has not come back. At least not so far, right?
Right.
We had it 17 years ago. It has not come back. How confident are you about COVID-19 being here now, but that's it?
I mean, I think there are a couple of different possibilities as to what's going to happen after we peak from what's going on here. It can fizzle out and die like SARS. I think that seems less likely given the way that this is behaving, the number of people that are not that symptomatic, that can transmit to others. But, so there are a few features that are different from SARS that make that unlikely. We may experience a couple of waves and then it will die down, or more likely, it seems, it will become something that we see seasonally. But COVID-19 is not behaving like what I think Andre Picard's referring to in terms of this disease X. What we're really afraid of is something with very high mortality rate that can also go from person to person very rapidly and cause a huge wave of disease that will kill a lot of people. Now, viruses don't tend to like that, though, because if they kill their host, then they kind of end their cycle. So, I think that's one of the reasons why we've been seeing some of these milder things come forward and cause disease, but not to that extent lately.
When these epidemics come forward, what do they do to our healthcare systems and the resources that we have right now and presumably need more of in order to handle this?
Well, I think one of the things that happens is that people forget. So SARS was 17 years ago. People forget what happened and how we have to prepare for the next one. And there was a study that was published about a year ago, and it said that people lose that memory within less than a generation. And I think when I saw the Ford government bringing out these public health cuts, I saw that's a lack of institutional or memory about why we need public health. And I'm glad and relieved that those cuts didn't go forward, and I hope that the government decides to take them off the table.
We got a minute left here, so let me ask you one last thing, Dr. Hota, which is a vaccine. What's the story on that?
Vaccines are in development. People are working on some candidate vaccines. The problem with the vaccine is it takes such a long time to make. So, first you have to go through finding a construct that looks like it might actually work in the lab setting and then test it on animals and trying to find a good animal model to actually decide that if it's something effective and safe, and then trial it in a number of human beings to see, again, if it's effective and safe. And finally, there has to be some kind of a pharmaceutical company that's willing to actually market this and bring it, mass produce it and bring it out to the field in a short time. So I think there are a number of challenges ahead with the vaccine development, but certainly something that we're looking to see, as a future intervention.
And who knows, by that time, the thing may be gone.
It's possible.
It's possible. Okay. Really appreciate this update from both of you. Dr. Susy Hota from the University Health Network, Mario Possamai, Senior Advisor on the SARS Commission. Great to have you both on TVO tonight. Thank you.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.